Good morning, and thank you very much to be here in this online lecture for third year MBBS. And the most important thing in third year, anybody who want to learn EKG, they should know how we start to read a normal ECG. And outline of this lecture, how what is the conducting system in the heart, what is QRS complex, how we can calculate the rate, what is excess, and what is rhythm. ECG basically a graphical representation of electrical activity which is going in heart, and this electrical activity generally start or normally start from the SA node. And SA node is present in the upper part of the right atrium. The SA node is a normal electrical generator where the electrical activity generate generally at a rate of 60 to 100 per minute. You can see here in this diagram the SA node which is present in the upper part of the right atrium, and that electrical activity which generate from the SA node to the AV node through internodal pathway. This internodal pathway is present whole of the muscles present in the right atrium and on the left atrium. The electrical activity which is start from the SA node goes into the AV node through internodal pathway, and that internodal pathway usually present in both left or right atrium. When the electrical current goes into the AV node, which is present at the junction of the atrioventricular septum, it stays for a while. And why it stays for a while or this electrical activity stop? Because it gives time to contract the right atrium and left atrium. And when right and left atrium contract, the blood goes into the right and left ventricle. When right and left atrium become emptied, the electrical activity continue again, goes into the His bundle, and from where it goes into the right or left ventricle through right bundle branch or left bundle branch. And from this right and left bundle branch, the electrical activity further propagate or stimulate the right and left ventricle through the Purkinje fiber. So it is a normal electrical current which originate from the SA node, pass through internodal pathway into the right or left atrium, stay for a while at the AV node, and then current passes further down through His bundle, which further divided into the right bundle or left bundle. It is a normal pathway to conduct current from the SA node to rest of the myocardium. Now, I have already told you this electrical activity, ECG basically is a graphical representation of electrical activity in the heart. For example, you can see here when the atria depolarize. What happened? The P wave formed in a graph paper. When the electrical activity stop or delayed at the AV node, you can see a PR interval. When the ventricular depolarize, the QRS complex formed. And when ventricle repolarize, the T wave formed. Now the electrical activity which is going on again and again in the heart, if you see in an ECG paper which showing in a graph, the P wave means the atria is depolarizing, QRS complex showing the ventricular is depolarizing, and the T wave shows ventricular is repolarizing. So here you can see a multiple complexes or wave. Some are interval. For example, P is a wave, QRS is a complex, and T is a wave. When two complexes join, it is called, for example, P wave and QRS joined by a flat line, which join the P wave to QRS complexes. This is called the PR segment. And from the start of the one wave to the start of the other complex or wave, it is called the interval. I'm again tell you, when two complexes or wave are joined, it is called the segment. And from the beginning of the one complex or wave to the beginning of the next complex is called the interval. Now you can see here two segment and two interval. Number one, the segment which is joining to the P wave and QRS complex is called PR segment. Similarly, if you see here a segment which join the QRS complex and T wave, it is called the ST segment. And from the beginning of the QRS to the end of the T segment, T wave, it is called QT interval. We have some other segment also or wave also. For example, a U wave, which may form in some electrolyte abnormalities. So now I think you are able to understand what is the wave, what is complex, what is the segment, and what is interval. Now why we use multiple leads? Why we use? Because it is an electrical activity which is present throughout the heart, but we can monitor or see electrical activity from different part of the heart. For example, we can see electrical activity anterior to the heart or lateral to the heart. For example, left lateral, right lateral. Even we can monitor this electrical activity on the posterior aspect of the heart. So we monitor the electrical activity all around the heart. And for our convenience, we have divided to see the electrical activity anterior to the heart, lateral to the heart. For example, if we want to see the electrical activity from the interior to the heart, we have to place our leads on the anterior of the chest. If we want to see the electrical activity laterally or inferiorly, we have to put our leads on the limb. So we have 12 leads. 6 leads we put on anterior of the chest to see the whole anterior part of the lead, heart. And we have 6 standard limb leads to see the periphery or lateral part of the heart. Now it is very important slide. Limb lead. What we do, we put a lead on the right arm or left arm. If current flows from the right arm to the left arm, where the current flows, or that arm which start flowing current, for example, current flows from the right arm to the left arm. The right arm shows or indicate as a negative pole or left arm as a positive pole. For example, a lead is attached from the right arm and current flows from right arm to the left leg. So what we denote or what we indicate, the right arm we will indicate as a negative, or left arm, left leg is a positive electrode. So we have 2 type of electrode. One is negative, one is positive. The current where from start flowing is a negative pole, or current which is going towards any arm or leg which is which will indicate positive pole. Now here, if we take a lead, we have 2 electrode. One electrode is present on the right arm and second electrode on the left arm. Current flows from right to left. Right is negative and left is positive. Now you can see lead 2. Lead to the right arm, 1 electrode, or left leg, the next electrode. Current is flowing from the right arm to the left leg. So right arm is a negative pole or left leg is a positive pole. Lead 3, left arm, current is flowing from the left arm to the left leg. Left arm is a negative electrode and left leg is a positive electrode. So this is called the limb lead. Now we have divided the heart in a different angles. If you remember the lead 1, यार यहाँ लिखा हुआ रहा है कि योर इंटरनेट केबल अनस्टेबल. वासिफ, हेलो
जी सर, नहीं सर ऐसा नहीं है, आपकी आवाज़ सही आ रही है बिल्कुल।
वासिफ, आवाज आ रही मेरी आपको?
जी, जी सर, बिल्कुल क्लियर आ रही है।
इस हेलो वासिफ,
जी, जी, जी
आवाज
बिल्कुल
आ रही है
क्लियर आ
आपको?
रही है। जी, जी सर, बिल्कुल क्लियर आ रही है।
यहाँ पर अनस्टेबल जो है ना वो कनेक्शन लिखा हुआ आ रहा था।
सर अभी सही आ रही है।
हेलो,
जी, जी सर, सही आ रही है, सही आ रही
अच्छा आवाज आ रही, ठीक है। नाउ इफ यू रिमेंबर this previous slide where you have seen lead 1, lead 2 and lead 3. Lead 1, one electrode is placed on the right arm and second electrode placed on the left arm. Current flows from the right arm to the left arm. It is called lead 1. Second electrode, which is placed on the right arm or left leg, which is called lead 2. Right arm is negative and left leg is a positive. 3 is the electrode is placed on left arm and current is flowing into the left leg. It is called the lead 3. So we have divided this flow of current into angular form. Now it is chest leads. You can see we have 6 chest leads. V1, V2, V3, V4, V5 and V6. V1 placed on the 4 intercostal space from the on the right side. V2 on the left side, 4th intercostal space, lead 4, 5th intercostal space, and V3 in between V2 and V4, V5 at the apex, and V6 at the anterior or mid axillary line. Here again you can see a section of the heart, and you can see here V1 and V2 is generally monitoring the electrical activity of the heart anteriorly, predominantly septal part of the heart. V3 and V4 placed anteriorly, and generally it sees the electrical activity of the heart anteriorly. And V5, V6 is placed on the lateral side of the heart. So if you see any electrical activity or abnormality in V1 and V2, what does it mean? It means that predominantly electrical activity you are observing is coming from the septum. If any electrical activity which is most dominant in V3 and V4, it means that you are watching or you are observing anterior part of the heart. Similarly, if you are see V5 and V6, what does it mean? It means that you are observing electrical activity of the lateral part of the heart. Right? Now I have show you a journal summary. If you see V1 and V2, what does it mean? You are observing septal part of the heart. V3 and V4, anterior part of the heart. V5 and V6 lateral part of the heart. 1 and AVL, if you remember, 1 start electrical activity from the right hand of the heart and goes towards the left hand. It means that you see a lateral part. So it is a brief introduction to how we take the or how we see ECG and what is the significance of the limb lead or chest leads. Limb leads means that you are seeing the lateral part of the heart. And in V1 to V6, you are seeing the anterior part of the heart, which include the septum, anterior and lateral. छक्के मार के चल गया। हाँ शायद अफरीदी थी है, शायद अफरीदी थी जो 4 पॉइंट बॉल करके चले। Now, rule of 300 and what is 10-second rule? We usually use to see or to calculate the heart rate. I will tell you later on. Now, this is the most important strip. Either you are in medicine, you are in gynae, you are in surgery. If you understand this strip or this slide, you can see most of the normal or abnormal ECG. You have seen this ECG strip a lot of time in your medical life. Maybe some of your family member have some heart disease, and generally physician order for an ECG. You see this type of a ECG strip which shows boxes. Here you see some large boxes and small boxes. If you go horizontally, it means time. If you go vertically, it means voltage. Now we have divided or we have measured the heart rate. How? For example, if you a small square and if you see large square, so when a strip coming out from the machine from one large square line of one large square to the line of second large square, it takes how much time? 0.2 seconds. If 5 large square coming out from an ECG machine, it takes 1 second. And in 1 minute, how much large square coming out from a machine? Anybody can answer me right now? Hello? Wasif? Hello? Okay, I will just continue because I think you are not able to answer my question. Actually, I want to know how many are following me. But Anyway, horizontally is time. If 5 large square is coming out from uh, from the machine, it means that there is 1 second. And in 6 seconds, 30 large square coming out from the machine. Or in 1 minute, 300 large square will come out from the machine in 1 minute. Similarly, if a QRS complex deflected vertically, it's 1 large square. It means how much millivolt is 5 millivolt, right? 5 small square, 10 small square is 1 millivolt, and 5 small square is 0.5 millivolt. It depends upon the electrical current and the thickness of the myocardium. Now, if you see here, how many large square here in this strip? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. We can say here is a 16 or 15 small square. 5 small square means 1, 2, 3, 4, 5. 1 second. 1, 2, 3, 4, 5. 2 second. 1, 2, 3, 4, 5. It means you can see it is a 3-second strip. If 15 large boxes coming out from a machine, it will take 3 seconds. In 3 seconds, this QRS complex shows the heart activity. It means in this second 3 times. In 60 seconds, how much time will heart will contract? 60 times. Here again a ECG strip, and again here is the large boxes are 15, and the QRS complex is 1, 2, 3, 4, 5. So how much rate is? 75 beats per minute. This is a rhythm which is called a dying rhythm. Sometimes if electrical activity, if there is no pulse, or it may be a ventricular tachycardia. I will tell you later on if we have some time to understand. So what is sinus rhythm? I'm skimming some difficult slides because we do not have enough time to cover all these things, and we cannot cover all this normal or abnormal ECG in one lecture. I just want to show the basic, and Abdul Manna, do you want to ask anything? Hello? Okay. So if you see here, start from the P wave. How many of you see P wave here? Now go back to basic. P wave. Here is a P wave. Now, how many of you can identify in this slide where is the P wave? Here is how many participants? 253 participants. How many of you can recognize or identify the P wave here? If more than 50%, it is good. If it is more than like 80%, is very good. P wave is the first deflection. Here you can see a P wave. How many of you can recognize the P wave in this ECG? The first deflection is the P wave. This is अच्छा ये जो मैं कर्सर यहाँ चला रहा हूँ ये बात नजर आ रहा होगा ये एक्सक्यूज मी जब मैं कर्सर यहाँ पे करता हूँ रन तो वो स्टूडेंट्स देख रहे होंगे ये ओके ओके ठीक है नाउ दिस इज द P wave and this is here you can see in this slide this is the P wave and how it formed. It formed because of the deflection or it is a deflection because of the atrial depolarization. So here you can see this is the P wave, right? And this is called the PR segment. Why it happened? Because the current is delayed at the AV node, right? Now here you can see in this ECG, this is a P wave and this is the PR segment. And this is QRS complex. And this QRS complex followed by the ST segment. And this is a T wave, which is the repolarization of the ventricle. Rate. How will you calculate the rate? We calculate the rate. We have different criteria to calculate the heart rate. Second, whether it is sinus or something else. Either it is arising from the atria or somewhere else. Either it is arising from the junction or somewhere else, or it is a ventricular rhythm. So we start normal sinus rhythm. If an electrical activity starts from the P wave followed by a QRS complex and end by a T wave, it is called the normal sinus rhythm. This is a normal, although it is not a normal ECG, but rhythm is a normal sinus rhythm, right? Rate. How will you calculate the rate? Here you can see this is the large boxes 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Okay, I will some other example. Okay, here you can see this is the large boxes 1, 2, 3, 4, 5. 1 second. 1, 2, 3, 4, 5. 2 seconds. 1, 2, 3, 4, 5. 3 seconds. 1, 2, 3, 4, 5. 4 seconds. 1, 2, 3, 4, 5, 6 seconds. 1, 2, 3, 4, 5. This is a 6-second strip. 6 seconds means the strip coming out from here to here it takes how much time? 6 seconds. In 1 second, 5. In 6 seconds, 30. If you calculate here the QRS complex, the electrical activity occurs during 6 seconds, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. What does it mean? In 6 second time, the heart beat 11 times. Or in 6 seconds, how much time heart beats? 11 times. So how many beats will occur in 1 minute? 6 seconds, 11. So if we divided 6 into 10, 60 seconds. So we can multiply. Similarly, if we multiply this electrical activity, 11 heartbeat in 6 seconds, multiplied by 10, what will be the result? 110 times. If you calculate heart rate like this, take 6 second strip for 30 large boxes from here to the here. This is 30 large boxes. In 1 second, 5 boxes. In 6 seconds, 30 boxes. Calculate the QRS complex multiplied by 10. You can easily get the heart rate. So now you can see up till now, okay, what is sinus rhythm? If electrical activity generating from the SA node, it will form a P wave. It is called the sinus rhythm. And if you can calculate the heart rate, what I have already explained you here, you will take a 6 second strip, calculate the heart rate in this 6 seconds, and multiplied by 10, you will get the heart rate in 1 minute. And it is a very easy and universal method. You can calculate the heart, either heart is regular, irregular, bradycardic, tachycardic. Whatever the rhythm, you can accurately calculate the heart rate. Now, up till now, you can understand what is the sinus rhythm and how will you calculate the rate. Now, the rhythm. What is rhythm? Rhythm means that at a constant interval, a certain process occurs. For example, one P wave followed by QRS complex, one P wave followed by another QRS complex, then T wave, and the distance in between two P wave or QRR complex is equal. It is called the regular rhythm. Other than is called irregular rhythm. So if you see the RR interval or PP interval, it is an equidistance. It is called the regular interval. You can easily calculate now up till now the heart rate. You can identify whether it is sinus rhythm or not, and you can calculate the regularity of the heart. I don't want to go into detail because it is not possible to tell you all the things. It is almost impossible. But I just want to tell you, okay, how will you start to see a ECG? So I have already told you an ECG, if we sum up till now, ECG is an graphical representation of the electrical activity of the heart, and the large boxes basically horizontally is the time and vertically is the voltage. Time is 5 large square is equal to 1 second, and 10 millimeter vertically up to 1 millivolt. Now, what is bradycardia? So, up till now, I think you can identify the rate, the rhythm, and whether it is sinus or not. Now, here, what is bradycardia? Bradycardia, if the rate is less than 60, or what we call in cardiology less than 50, is bradycardia. For example, this is a large box is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. We can say this is a 6-second step, or here is from here to here is a 30 large boxes. And how many complexes here? 1, 2, 3, 4, 5. In 6 seconds, the heart beat 5 times. So how many times in 1 minute? 50 times. It is called the bradycardia. Similarly, you can see here a P wave followed by a QRS complex. P wave followed by a QRS complex. P wave, it is called this sinus rhythm. Current is originating from the SA node. Similarly, if you see the RR distance from here to here, from here to here, from here to here, it is equidistant. It means it is a regular rhythm. So now, if anybody show you an ECG like this, what will you see and what will you say? It is a normal sinus rhythm showing bradycardia. Now here, again a 6-second strip. What is it? It means when this ECG is coming out from here to here, or ECG strip, it will take how much time? 6 seconds. In 6 seconds, how many times heart beats? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. In 6 seconds, heart beat 11 times. In 60 seconds, what will you do? You will multiply it by 10. Heart rate comes out 110 per minute. It is tachycardia. Now, what will you see, or what will you say? This is a sinus rhythm which is showing tachycardia with some other abnormality as well. So this is a sinus rhythm, but ECG showing tachycardia. Here you can see how many large square? 1, 2, 3, 4, 5, 6, 30. I would say this is a 6-second step. And how many times heart beats? 1, 2, 3, 4, 5, 6, 7. Multiplied by 10, 70. Rate is 70. And you can see here the P wave followed by a QRS complex. P wave followed by a QRS complex. But here you can see a P wave which is different from this one. And it comes early. Here P wave comes after 5, 10, 15, 20 minutes. 20 small boxes. But here come after 10 small squares. What does it mean? It is a P wave which is morphologically different from this P wave. It means it is arising from somewhere else, and it is coming early. Whatever thing which is come early is called premature. For example, a baby deliver early, it is called the premature baby. So similarly, this is a premature beat. So this, but it is looks like a sinus or arises from the not sinus or arising from the atria. So it is an atrial contraction which is coming early. So it is called the premature atrial contraction. This is a different type of premature beats. I don't want to go in the detail of these things because it is too early for you people. Now, it's again a 6-second strip, and heart is contracting how many times? 1, 2, 3, 4, 5, 6, 7, 9, 10, 11, 12, 13, 14, 15, 17. So, what is the heart rate in this ECG strip? 130 tachycardia. And you can see here the different morphological P wave. Different. ये different है. This is a different one. This is different. This is multifocal. There is a multifocus focus in the atria which is generating current which is going into the ventricle. This is multifocal atrial tachycardia. It is an atrial flutter. Atrial fibrillation. What is atrial flutter? It is a focus in the atria which generate current multiple times. But some of the atrial current goes into the ventricle and depolarize the ventricle. So atria in this ECG, atria ventricle contracting 50 times per minute, but atria is contracting 300 times per minute. And every fourth electrical or fifth electrical activity is going into the ventricular conducting system and causing ventricular depolarization. So every fourth or every fifth electrical activity depolarizing the ventricle. It is flutter. Fibrillation, what does it mean? It is very common. Arrhythmia. Whenever you see a pulse which is irregularly irregular or ECG which is irregularly irregular, if you say it is an atrial fibrillation, so most of the time you will be right. There is a multiple focus from different area in the atria, and some of that electrical activity irregularly passes from atria into the ventricle and depolarize the ventricle. So will you see an irregular ventricular contraction? Here you can see a different distance, RR here and here is a different. Every RR interval is a different. So it is atrial fibrillation. Again, it is also an atrial fibrillation, but it is a controlled ventricular rate. The rate in this ECG is how much? 40 per minute. Why? Because it is 6-second strip. In 6 seconds, the ventricle is contracting 4 times. Multiplied by 10, it means it is 40. The lot of atrial depolarization, which is called the fibrillatory wave, you cannot appreciate here. It is an atrial tachycardia. AV nodal block. I have already told you, one small square is 0.04 second. and one large square from here to here is 0.2 seconds. And what is interval? Start from the one complex to the start of the next complex, right? And the normal PR interval is 0.12 to 0.20 seconds. What does it mean? 3 small square to the up to 5 small square. If it becomes greater than that or more than 5 small square, it is called the first degree AB block. It is second degree AB block. What does it mean? Okay, here you can see a P wave which is a PR interval. How much? Around
सर आवाज आ रही है आपको?
hello,
जी आवाज आ रही है?
7 small square, and here is a 10 small square. And if you go here, there is a P wave but no QRS complex. So further lengthening of the PR interval with each beat followed by a drop, it is called second degree type 1, or it is also called the Wanke-Beck. So this one is the first degree where the PR interval is prolonged, and here is a lengthening of the PR interval with each QRS complex followed by a drop. It is called the second degree type 2 block. There is another type of block which is called the second degree AB block.
हेलो डॉक्टर, आवाज आ रही है आपको?
जी आ रही है
सर मैं कह रहा था 10:20 हो गए, दूसरे लेक्चर का टाइम हो गया।
अच्छा हो गया यार। ये स्टूडेंट कुछ क्वेश्चन पूछना चाह रहे हैं। अब ये इतना बड़ा लेक्चर दिया हुआ, ये बच्चों को पता नहीं, आई डोंट नो इनका क्या क्वेश्चन थे। चलो क्वेश्चन ले लें क्या?
जी सर ले लें। आप नीचे देखिए, आपने माउस से नीचे मोर का ऑप्शन आ रहा होगा लिखा हुआ।
हेलो, क्वेश्चन ले लें क्या?
जी ले लें। नीचे मोर का ऑप्शन लिखा आ रहा होगा, देखें।
मोर
आ रहा है सर?
मोर आ गया।
उसके उस पर क्लिक करें, सबसे ऊपर चैट
मोर आ गया। क्या करूं? सबसे
ऊपर चैट लिखा हुआ आ रहा होगा, देखें। मोर पे क्लिक करें।
किस पे? मोर
के ऊपर क्लिक करें।
हाँ चैट आ गया।
अब चैट ओपन कर लें।
क्वेश्चन बच्चे पूछ रहे हैं वो पूछेंगे। हाँ एट्रियल फ्लटर। ओके, ये किसने कहा? ये सारे क्वेश्चन आ रहे हैं। अच्छा, सोमिया अली, what is atrial flutter? Okay, I will tell you again. What is atrial flutter? It is an abnormal rhythm, or it is an arrhythmia which generally occur in some disease condition. And in this condition, what happens? Atria depolarize multiple times, but the focus is remain the one. For example, if you see this slide, the atria is depolarizing how many times? 1, 2, 3, 4, 5. And this fifth electrical activity or electrical current which is generated into the atria goes into the ventricle. What does it mean? Every fourth or fifth electrical activity which is generating into the atria goes into the ventricle. So multiple wave is called the flutter, and because it is arising into the arising in atria, it is called atrial flutter. And not all atrial activity goes into the ventricle, but some of them goes into the ventricle. So it is called the atrial flutter. Segment and interval. Acha, cardiac access from R. From R, you can come in my office because it is a very detailed topic, how to calculate the access. If you come in my office, I will tell you in my office. Nida Ali, please explain segment and interval again. Yes, I will again, because it is very basic thing. What is segment and what is, if you see this ECG, any complex or wave which is joined to the other wave or complex. For example, this is a QRS complex S, or this is a T wave. So QRS complex joined by T wave through ST segment. So a complex joined by another complex or wave is called the segment, or interval means the beginning of the one complex or wave to the beginning of the next complex as well. It is called interval. Somiali, yes, I'm sorry for my voice is breaking. It is not my fault, but it is a unstable connection problem.
सर मैं क्लास एंड करूं?
चले एंड कर दें। अच्छा, प्लीज निदान, मैंने आपको ये एक्सप्लेन कर दिया है, और आप टॉपिक ये कहीं से भी पढ़ सकते हैं। यू कैन रीड एनीवेयर in the medical books. You can stop. I think we should stop here. And any query from a student side, so you can come in my office. I am coming regularly, and we will answer you each and every question. So from here, thank you very much, all of you, and I will stop here.